Sexual dysfunction in men is a physiological and a psychological issue that can have real limitations for the quality of life for the man and partner. Welcome guys to Private Therapy Clinic, and today we're going to be taking a look at sexual dysfunction and sexual disorders amongst men. We're going to be looking at the psychology behind that, and we're going to be looking at the treatment options that are available, such as CBT, that can be really helpful. Now, like I said, one of the best treatment options available is cognitive behavioural therapy, or CBT. And here at Private Therapy Clinic, we provide such a service with some fantastic therapists that can help with any issue. So if there's an issue regarding sexual dysfunction or a sexual disorder, then it's important that you get in touch with us and we'll be able to help you where we can. So the first question that we have to ask is, what exactly is male sexual dysfunctionality? Well, it includes a number of different factors. Things such as erectile dysfunction, premature ejaculation, and low libido. And as I've said earlier on, it has real implications for affecting the quality of life for the individual and the individual's partner. Now, with a very brief introduction to what exactly sexual dysfunctionality is all about, what kind of prevalence does this have in society? What percentage of men are actually affected by sexual dysfunctionality? Well, up to 30% of men in the United Kingdom state that they have an issue with some sort of sexual dysfunctionality. Now, it could be one of the three or something else that we've spoken about, such as erectile dysfunction, premature ejaculation, and low libido. Now, over 20% of men in the United Kingdom aged between 40 and 80 have stated that they've experienced some issues with erectile dysfunctions. So you can start to see that this is actually a bigger issue than maybe some think. Sexual dysfunctionality has a real implication for the quality of life of people, and it actually is pretty prevalent in society today. So the next question we might have to ask is, what exactly are the causes of all of this? We understand a little bit more about the prevalence of it. We even understand a little bit more about what it consists of. But what actually causes this issue? Remember, today we're taking a look at the psychological reasons behind it. There are, of course, some physiological reasons that we have to be aware of that can have an influence on sexual dysfunctions. Things such as low testosterone. Research has shown time and time again that when there are dips in testosterone levels, particularly when men get older, they can start to experience issues with erectile dysfunction, low libido, and premature ejaculation. Prescription drugs also have a role to play, particularly drugs that have a focus on reducing high blood pressure. Now, once again, these kind of medications are typically prescribed to older individuals. So as men age, they're more likely to experience some of the issues, some of the physiological issues that come about when they experience sexual dysfunctions. As well as general drugs, antidepressants can also have an influence on physiological responses that equate to sexual dysfunctionality in men. Blood vessel disorders, where there's a hardening of the blood vessels and restricted blood flow, can have an influence on erectile dysfunctions. And things such as excessive drug taking, smoking, and alcohol consumption have all been correlated to experiencing sexual dysfunctionality. However, like I said earlier, the purposes of this video, we're going to be taking a look at the psychology behind these issues, and there are a number of psychological factors that are related to sexual dysfunctionality that are often overlooked. For example, worries over sexual performance. Now, this can become very much a perpetual cycle where men feel that their performance is lacking in some way, and therefore they get worried about it, and things increase and concerns develop, and you can start to understand a little bit more about how this ball starts to roll. Relationship issues as well can also have a big influence on the psychological reasons behind sexual dysfunctionality in men. If men and their partners are in some way having arguments consistently, or the relationship is changing in some way, that can have a real influence on sexual dysfunctionality. Things within the mental health domain, anxiety and depression, all of these factors, as I'm sure we can understand, can start to have implications for sexual performance, and some of the things like low libido, erectile dysfunctions, premature ejaculation, all of these kind of things can be associated to challenges with mental health. Another perpetual cycle other than just worry that we have to be aware of is these feelings of guilt. What can often happen is one of the psychological reasons behind sexual dysfunctionality is that men sometimes feel guilty that they're not performing at a high enough level to please their partner. Once again, this ball increases and it rolls faster and faster, and the issue becomes bigger and bigger than from when it first started. There are also things to be aware of when it comes to the subjectivity of the individual. Perhaps traumatic events in childhood or later life have subsequently meant challenges in sexual performance and issues with sexual dysfunctionality. Things such as childhood sexual abuse is an example. And there's also something to be said about stress and fatigue, primarily associated to work, especially as men get older. Stress and fatigue can increase, and we can start to see implications on sexual dysfunctionality as a result. Now, as we said earlier, there are a number of different factors attributed to what we associate as sexual dysfunctionality, and premature ejaculation is one of the ones that we've spoken about. And studies have suggested that serotonin breakdown, which is a hormone that affects our moods, the breakdown of that can have a real implication on premature ejaculation. Now, this is part of the reason why I spoke about antidepressant medication when we're looking at the physiological factors here, because antidepressant medication has a real focus on manipulating our serotonin levels at times. So if serotonin manipulation or the breakdown of serotonin has a real implication on premature ejaculation, then we can start to see how antidepressant medication can have a role as well. There is also something to be said here about the natural breakdown of serotonin as well, though. It's not just the fact that somebody on antidepressants will experience premature ejaculation. Somebody who's not on antidepressants can also experience it due to the natural progression of breakdown in serotonin. Things even such as nerve damage to the spine, the spinal cord or the back can have implications for premature ejaculation as well. And other medical conditions such as diabetes, which is increasing in our society, also has a role to play. Now, there's premature ejaculation that we've spoken about. We've spoken about low libido when it comes to fatigue and stress and the aging process, which is a natural progression for this low libido. But erectile dysfunctionality is also something that we need to be aware of. Now, this is where there are challenges in initiating or sustaining an erection. Again, all of the factors that we've spoken about here already apply. Like we said earlier, physiological conditions such as the hardening of blood vessels can have a real role to play. However, once again, psychological factors, all of which we've spoken about today, have a real implication for things such as erectile dysfunctions and are often overlooked. More often than not, when it comes to sexual performance, when it comes to sexual dysfunctionality, we think that there's a physiological thing. We think it's an aging thing, or it's a low testosterone thing, or it's a medical condition thing, or it's a drug prescription thing. More often than not, though, psychological influences and psychological factors of which we've covered today have a real impact on the development of sexual dysfunctionality amongst men. So we've taken a long, hard look at what sexual dysfunctionality is, the causes of it, the symptoms, where it comes from, what it is, the prevalence of it. But what about the treatment of sexual dysfunctionality? And as I said at the start of the video, CBT, cognitive behavioural therapy, is deemed to be a hugely impactful, positively impactful form of treatment for those suffering from sexual dysfunctionality. Now, it works in a number of different ways when working with sexual dysfunctions. One of the ways is the utilisation of psychoeducation. Now, this is where the therapist, the CBT therapist, will engage with the client in a subjective way, inform and educate the client on what sexual dysfunctionality is all about, and come to a cohesive understanding of that subjective nature. So what actually the factors are for that subjective client that's driving the issues of sexual dysfunctionality. Psychoeducation can give us that objective view. It can give us an understanding of the issue at large, but it can also narrow down on what actually the client in front of us is dealing with and what those factors are doing and contributing to sexual dysfunctionality that's being experienced. Another thing that CBT can do when working with sexual dysfunctionality is removing that pressure to perform. Remember the perpetual cycles that we spoke about before? Well, CBT has a real focus on addressing these. And it does this both by addressing our thinking patterns and our behavioural patterns. Now, those are the two concepts to CBT, that cognitive level, that thinking level, and that behavioural level. And the mechanisms, the philosophies behind CBT is that if we can change our thinking patterns, we can also change our behavioural patterns and ultimately how we feel and how we respond to certain situations. So in CBT, working with sexual dysfunctionality, changing those thinking patterns, changing those perpetual cycles will ultimately change those behavioural patterns. And as a result, we'll see real positive implications. CBT also works with the anxiety to perform. Often what happens with sexual dysfunctionality is that men are drawn away from their own sensations. They develop a fear for failure, for example, and they create more tension in their body as a result of those anxieties. CBT will have a focus on actually reducing those anxieties, learning a little bit more about what exactly it is the individual is anxious about, putting in behavioural and thinking patterns in place to help alleviate that anxiety. Other things such as relaxation and focusing techniques are utilised. As a result, there's going to be reductions in this demand for performance, this anxiety of performance, and a focus on the individual's own sensations during sex. Guys, thanks so much for watching this private therapy clinic video today on sexual dysfunctionality amongst men and the treatment options. Don't forget what I said at the start of the video here today, that at Private Therapy Clinic we have a number of highly qualified therapists, particularly in cognitive behavioural therapy, that can help to work with any issue that an individual brings. And if sexual dysfunctionality is something that you think you suffer from, or that somebody you know suffers from, then Private Therapy Clinic is here to help. And finally, thanks so much for watching.